of course, in building that. But tell us more about what has been the biggest impact as far as the digital healthcare access is concerned in the country when it comes to affordability. You also, of course, mentioned a while back about the urban centers and the rural centers. But if you could just help us understand the impact, your company has brought in with this access to digital healthcare when it comes to the affordability of medicines and even diagnostics.
So I think the biggest challenge in healthcare actually for most consumers is opacity. That healthcare is, it's dished out to them. The system kind of decides what they need to do, how much they need to pay, and how they will receive it. Transparency helps a lot, and I think it's a great, it empowers people once they know better. Whether it is the government's Jan Aushadhi program, whether it's the transparency that platforms like us provide around a lot of these things, that's one part of it. The second part of it is also, unfortunately, the supply chains in healthcare in India are very variable. There are a lot of bad actors and a lot of quality issues, both in pharma and in diagnostics. In pharma, we all intuitively understand we hear about fake medicines, and depending on which report you read, 5%, 30%, both are big numbers. A lot of medicine in India is not of standard quality. Now, platforms like ours are able to ensure authenticity, ensure quality, and we are able to do that because we work through technology systems. 100% everything is digitally traceable, trackable, where it comes from, where it goes. In this case, which pharma company, we directly buy from pharma, it came from which warehouse, then where, finally right up to the doorstep, at what temperature across that entire supply chain the product was kept. All those are important things in healthcare. Those are not good to have, those are necessary table stakes, but unfortunately the ecosystem does not have it. Same in diagnostics, a big problem in diagnostics is the entire industry around what is known as sink tests. So you take people's blood and throw it in the sink and give them a printout. Unfortunately, it's not as rare as one would like it to be. It's a reasonably decent part. So giving an authentic, digitally enabled, end-to-end trackable, trustable platform to consumers to get high-quality healthcare. And this is the way that we have evolved also, because I think in the early phase, a lot of consumers would try us out for either price or convenience. But today, consumers come to us and stay with us because they trust that what they get is actually the right healthcare that they need at the right price for that healthcare.
There is a behavioral change, you see.
There is a shift clearly happening. Consumers are sticking to platforms, and that trust, as I said, as it is getting earned, the consumers are much more aware today. Consumers are, earlier what used to happen is the moment you mention anything about healthcare, the mind shuts down. That, not for us, too technical, too complicated. Now the consumers have started engaging. They want to know why. Why this, why not that, what's going on. They'll go all over Google, ChatGPT, this, that, learn sometimes a lot more than they need to even understand, but they want to know. They want to be involved in what's happening to me, why, and is it the right thing for me at the right price? Which is exactly the movement we believed would happen. So we are seeing that, and we are just catering to that consumer requirement.